Hi guys, welcome back to my channel, The Spiceness. So October is Breast Cancer Awareness Month, and we're just here to educate you guys a little bit on breast cancer. So today with me I have Nurse Lois.
Hi, it's good being back here again.
Okay, so just a general overview of breast cancer. So breast cancer is a cancer that starts originally at the breast. 1 in 8 women most likely will have a chance of getting breast cancer, right? So 95% of the cases, once self-examination is done and you detect it early, you have a better chance of surviving.
Yeah, early detection, as they say. I mean, if we just adding with what Nurse Hunt was saying. Also, you have male as well have to do self and breast examination as well, because they as well could come down with breast cancer. So some of the risk factors you have, like when you have like early period before 12 in case of young ladies, you have like women that do not give birth to children, or if you start in childbearing over 30. They're saying also that if you people at greatest risk are at over 65 years or between 40 to 45 years, you have that occurring as well. Right, if your daily intake of alcohol consumption also could lead to that. You also have uterine
Cancer.
uterine cancer.
Yes, a
Right?
history of uterine
So history of
cancer.
uterine cancer as well, that could also cause predispose one to developing breast cancer.
And also females who go through menopause before the age of 50, they will be predisposed to breast cancer as well. So some of the ways that you can self-examine yourself. Okay, so we'll have a visual here. Nurse Lewis will give us a visual of how you can actually self-examine for any signs.
So what they're saying that early detection is the key, right? And that we need to teach, especially young ladies, males as well, teach them how to do proper breast examination. Yeah, so basically put me on the spot. So
Right, so we start from the auxiliary. Right, so we're going to start with the circular motion. So you got to start from the, let's see what he's doing it there. So by your armpits there, close to your shoulder, you go, you use your 3 fingers here, circular motion. So you go soft, medium, light, like right around the breast area. Right, so you're gonna see if you feel any lump or anything like that. We also have the up and down motion, where you also start from the top, yeah, and you come down. Yes, you feel. Yes, and you see how he has his hand behind his head. So this is, you can do this in the shower or if you're sitting like this. And also we have the wedge method. The wedge method would be, you start from the middle and then you come out. Yes, so you're gonna feel for lumps. So you know yourself best. So any unusual feeling, you should go and check it out with the doctor. Also, you need to stand in front of the mirror with your hands on your hips. Yes, and then you can bend down if you see any dimpling or any unusual shape, swelling, redness. That could also be a sign. Okay, so as Nurse Lewis was saying earlier, that breast cancer does not only affect women, it affects male as well. So the signs that males need to look out for is like the axillary lymph nodes. So you see where he started, like so right under the arm.
under the armpit.
Yeah, so the axillary lymph nodes, and then you would see an infected open sore, and you will also notice that your nipples are inverted, and also you will feel the lumps. So it's not only for females, so males, you should check yourself as well. Okay, so it is very important for females as well as males to self-examine themselves at least every month to make sure that there's no lump. So and if there is, you'll be able to go to the doctor and get yourself checked out, because normally the lumps would be found by yourself and not really the doctor. So if you find that you're seeing any dimpling, swelling, redness, and you do the examination and you're feeling any lump, you should go and get that checked out.
Right, and you just want to ensure that you do that after your bleeding would have stopped. Right, you want to check after bleeding would have stopped, or
Menstrual cycle.
the menstrual cycle of bleeding for local term would have stopped, and you want to ensure that you do that every month at the same date. So if there's anything, you'll be able to pick it up. Yeah, so that's it for me. Peace.
So thanks for watching, guys, and we're here with Nurse Lewis, and she's going to teach us how to do a self breast examination.
Okay, so it's not the ideal way we're doing it here, because the patient is usually supposed to be lying down with their arms behind their head for whichever breast that you are examining. So we're just doing a little demonstration, right? So remember, as I said, if you're doing it on yourself, you'll lie on your back with your arm behind your head with the breast that you're examining. Okay? So I'm going to use Nurse Hunt here as my patient, right? So for the circular motion, you will start under the armpits, because remember there are lymph nodes and so under there. You will come around, you anchor the breast with the other hand, you come around in circular motion, you go up to the chest, you come all the way around until you get to the nipple. And what you will do with the nipple, you will squeeze to see if there's any discharge from it. You will also look for dimpling of the nipple, right? Inversion, when it goes our nipples are supposed to be outside, but sometimes if it's inside, then you know something is wrong, so you look at that as well. The other way you can do it is in
The
wedge motion. So you would use your fingers again. These your four fingers that you're using here, your 3 fingers, and you would take it from all angles, from the armpit. We take it from under the armpits again, and you come in a wedge. You're heading towards the nipple, right? So you go under, right, from the top as well, and you end up at the nipple. Right now, the last method that we want to show you is the method where you go up and down. So you would start from out here again, and you walk your fingers down. So you're walking down on the side of under your armpits here. You will come back up, go under your breast, so you're going directly under it. So for some persons, you may have to lift it up or so, according to the breast size, right? You would go up and down. Sorry. You're walking your fingers back down. Same motion until you do the entire